Joining us now is Dr. Irwin Redlener, MSNBC public health analyst and the founding director of Columbia University's National Center for Disaster Preparedness. Olivia Troy is also with us. Dr. Redlener, give me your sense of where we are now and where we're heading on this current path.
Hi, Nicole. So really the trajectory is out of control right now and heading basically straight up. Many of us were predicting that we'll be seeing 200,000 cases per day by or before Thanksgiving, and I'm afraid that's where we're heading. The hospitalization rates are particularly important because these are reflecting the data that's suggesting that people are getting quite sick, going into ICUs, having to be admitted to the hospital. So the immediate prospects are not good, which is why we're particularly worried about making sure people get the message about how we can safely manage to get through the holiday season right now. But this is not going to be a good winter by any stretch of the imagination, Nicole.
How do you communicate with a country that has tended to view through a partisan lens some of the simple and non-invasive measures like mask wearing and social distancing and not being indoors? And how do you inject into that the long-term hope of a vaccine on the horizon?
Yeah, good questions, Nicole. So I don't think any of us in public health would have imagined a year ago that even with Donald Trump at the helm, that this level of incompetency and toxic messaging that we've seen with Donald Trump over these last 8 or 9 months would have actually been possible under any president's leadership. But here you have it, a president who's firmly opposed to science and evidence in developing policies to deal with this very deadly disease, who continues to this very day, and there's no sign of him stopping, even after he leaves. I'm assuming he'll leave. When he leaves the White House, this toxic messaging is going to be appearing throughout the rest of this next year or two, because Donald Trump will not give up in promotion of horrible, erroneous, anti-factual, anti-science messages. This has poisoned the atmosphere to a point where there's going to be a big job here for the new president and vice president and their administration to turn around narratives that the president has deliberately created that are completely erroneous and very, very dangerous. So it's not so much, it's the science, of course, but it's also how this is articulated to people that's going to make a lot of difference. As far as the vaccine is concerned, you can't say it's not good news. It is good news. But as Dr. Patel said earlier on your show, this is not just about the vaccine, it's about vaccinations. And the task of getting everybody vaccinated, it needs to be, is an onerous and huge chore for us going forward.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.